From the News Channel 5 network, this is Medical Mondays.
Good evening, everyone. Thank you for joining. I'm Carrie Sharp, and today's topic is going to be a fun one. We are talking about babies, planning for babies, having babies, and everything that comes in between. So if you have a question about pregnancy, about delivery, about getting pregnant, or why you can't get pregnant, tonight is the night to call. We have a lovely doctor here with us tonight, Dr. Kristen Walco. Thank you so much for being with us. Nice to meet you. You have kind of a newer addition to Women's Medical Associates of Nashville, so welcome on board to them. Tell us about how you got interested in obstetrics and gynecology.
So in medical school, I knew that I liked surgery. And you can either go toward surgery or you can go toward a mix of surgery and, continuity of patient care. And I really liked having a relationship with my patients. I liked that kind of lifelong care and relationship that you have with them. So that's really what drew me toward being an OBGYN. I meet the patients, I take care of them through their pregnancies, deliver their babies, and then later on in life I take care of them as they may need surgery and as they get older, and I really liked that.
And I think that all women know who have been to an OB, you have a special kind of relationship with that doctor that you don't have with any other doctor, because often you're talking about emotional, very private issues, and so you do have a bond and you want that special relationship. Don't you think so? You're a mom.
Yes,
you're
exactly.
a woman. You know this.
Yes, exactly. I mean, when I was choosing my own OBGYN, of course I chose somebody who not only was, my colleague, but my friend and a trusted advisor as well. So I can really appreciate, when patients are choosing an OBGYN.
So I mentioned tonight's topic is all about babies. Whether you're planning a pregnancy or you're just pregnant or you're rounding out your pregnancy, you want to get pregnant, you can't get pregnant. If you have questions, tonight is the night to call. Not only do you get free advice, but maybe advice that can help you along your journey in this. So go ahead and give us a call. We'll get those lined up. 615-737-PLUS is the number to call. 615-737-PLUS. Our producer will get those lined up, and as soon as we get them, we'll start taking them. So again, this is your night to call in, but I'm going to ask the questions for now. So if someone is planning a pregnancy, if a patient has been seeing you for a while and they say, you know what, I'm thinking about getting pregnant, maybe in the next year, we're going to start trying, what's the advice that you give them at that point?
So when a patient, says, I'm planning on getting pregnant in the next 6 months to a year, my husband and I have been talking about it, I tell them first and foremost, you want to this is going to be a marathon, something that your body has never gone through before. Okay, so you want to really prep for that. You want to be at your healthiest. You want to, start paying attention to your diet, paying attention to your exercise, and, kind of just preparing your body for one of the hardest things it's ever going to do.
Yeah, without a doubt. And it's a 10-month duration once you do conceive. So it really has to be, you do, if you can, it's nice to prepare. Nutrition-wise, what should people be thinking about and doing?
So nutrition-wise, nothing, prior to pregnancy, nothing really different. Okay, I tell patients, fad diets, I definitely recommend against. Okay, so there's no specific diet plan that is going to be your miracle. Okay, so a healthy, balanced diet. Now, if a patient has, certain diet restrictions, if they're a vegetarian, I'll talk to them about, different supplements that they may need during the pregnancy, making sure that they get enough iron because they're not eating the red meat, obviously, so making sure that they get their greens, and they can always start a prenatal vitamin before you get pregnant. That's why it's called a prenatal vitamin.
Right.
So,
and a lot of that includes folic acid, which is so very important and really important before you do get pregnant. Explain why.
So folic acid is necessary to prevent neural tube defects in the baby. Okay, so a neural tube defect is essentially spina bifida. Okay, and it's basically an opening in the baby. So there are variations in the severity of that, but that's very easily prevented, especially in America, where we have lots of resources and lots of our food is supplemented with folic acid. So I tell patients, take that prenatal vitamin. That'll give you pretty much everything that you need as far as the folic acid is concerned, in addition to all of the foods that they normally eat.
If someone is working on getting pregnant, do they need to stop drinking just in case? Do they need to stop smoking just in case? What do you tell them?
So I get this question a lot. Smoking, certainly. Okay, so smoking, any patient, whether they're planning on getting pregnant, whether they're planning on never getting pregnant, I counsel all my patients to stop smoking. Okay, e-cigarettes. That's not stopping smoking. Okay, so no cigarettes, no chewing tobacco, obviously, no e-cigarettes. And the sooner the better. There's really no...
Right, it's only going to benefit you. Yeah.
Right, and cigarette smoking during pregnancy, we know that it's extremely harmful not only to the mother but also to the baby.
Yeah.
So you can have low birth weight, it can contribute to other complications in pregnancy, and it's easily prevented. I know it's difficult to stop, but it's certainly necessary. Alcohol, while you're getting pregnant, or while you're trying to get pregnant, that's kind of the gray area, because there is about a 5-week time span where you could be pregnant and you don't know it.
Yeah.
So I tell patients you don't necessarily have to go cold turkey. If you have, a half a glass of wine here and there during that kind of gray area where you're trying to get pregnant, usually no harm. Okay. As soon as you find out you're pregnant, obviously no alcohol for the next 10 months. And then if you're breastfeeding, longer.
Yeah. Keep that alcohol in the cabinet. There will be a time later on. I see we do have a call, so we'll get the name there in just a second. But let's talk about once folks do get pregnant and that alcohol question, because I'm sure you've had patients that come in and say, oh my goodness, I'm pregnant, I didn't know, I've had a few. Do people need to be worried? What are the risks?
So I get that question from pretty much every pregnant patient that comes into my office. They're like, I had some drinks, I didn't know I was pregnant.
Yeah.
Usually at that point, when I see patients, they're 8 or 9 weeks pregnant. If nothing has come of the pregnancy at that point in time, if no harm, a miscarriage, etc., it's an all or nothing at that point. So if nothing has happened, then everything's fine.
Good to
essentially.
know. I'm sure that's a sigh of relief for a lot of people at that point.
Yes.
All right, I always promise when we get calls, we'll jump right to the line. Marilyn is on the line. Marilyn, thank you for being with us tonight. What's your question?
That's an excellent question, Marilyn, and thank you so much for calling in. So I actually have a lot of patients like this, and I tell patients, once you are planning to get pregnant, you stop your birth control. If you are under the age of 35, I usually recommend trying to get pregnant with your husband or your partner for 12 months. Okay, if you haven't conceived at that point, then come to the doctor. Now, 12 months is a really long time.
Too late. Sure.
Okay, and patients, especially when they're 33 and they've been waiting and planning for this for a really long time, they usually can't wait that long. So in reality, it's 6 months. Okay, so the official recommendation, 12 months, but usually it's 6 months.
People show up on your doorstep saying, it's not happening.
Exactly. Now, if you're over the age of 35, fertility decreases as you age, and I always recommend patients come in and have a conversation with their OBGYN. But certainly before 6 months.
Yeah. Okay, Marilyn, good luck to you. Hopefully you've got baby news here in the future. I do have a question about the age thing. I had both my little boys after 35. So, is it the age or is it your physical well-being that really makes a difference? Because someone can be 35 and look one way and feel one way and be in a physical, capability, and then you have another 35-year-old that's completely different. What is it?
Yeah, so unfortunately it's a lot of different factors, and you can be the healthiest, most fit 35-year-old there ever was, and you still have a decreased egg supply. A lot of that can be genetics, and we don't know. There's so much that goes into it. We really don't have all the answers for that, but I would not, you can ask, your family history, you can ask your mother, ask your grandmothers, how old were they when they had their pregnancies, if they had any problems, if they had a lot of miscarriages. And that's one way to start. But I tell patients, it doesn't matter how healthy that you try to be, you can't really control how many eggs you have. So I certainly wouldn't, bank on that, and, have that conversation with your OBGYN earlier, while there's still, something that you can do about it.
Absolutely. Okay, some great information already. If you have a call, now is the time to do it. 615-737+. We're going to take a quick break, and we're coming right back talking babies tonight. Stay with us.
When you get hurt, you know what to do.
Call Hughes and Coleman.
Call 800-800-4600.
All you do is call.
And they take care of everything.
800-800-4600.
800-800-4600.
That's an easy number.
Studies show people who call a lawyer on average get up to 3 times more money.
That's a lot of moolah.
800-800-4600.
Hughes and Coleman. 800-800-4600.
If you spend any amount of time at the great outdoors, hunting or fishing, you need to watch Southern Woods and Waters on News Channel 5+. Join host Hugh McNaughton and our area's top sportsmen as they share their experience and knowledge. Southern Woods and Waters is all about Middle Tennessee, and it's live. Call in with your questions. Whatever the season, that's what they're talking about. Tune in to Southern Woods and Waters Thursday night at 8, or catch the encore presentation Sunday night at 8 on News Channel 5+.
Spacious skies, for amber waves of grain, for purple mountain majesty, above the fruited
This is where you were first alerted.
Slams into a cycle.
This is where you first saw it.
Multiple warnings.
You got your first warning here.
Rescue efforts.
This is where you shared this. Every day, more people watch News Channel 5 to stay safe, informed, connected.
Sky 5.
You made News Channel 5 #1 in every single newscast. This is a News Channel 5 Network encore presentation. No phone calls, please.
Welcome back to Medical Monday. Tonight we're talking with Dr. Melissa Walco from the Women's Medical Associates of Nashville. Thank you for being here with us.
Yes, thank you for having me.
Dr. Walco is an OBGYN, so she's here to answer your calls about pregnancy, about childbirth. Any questions you might have, we're taking them tonight. 615-737+ is the number to call. Let's talk about exercise when you're pregnant. What should you do? Anything that you should avoid?
Yeah, sure. I get a lot of questions about this from my patients, and if a patient comes in to me and they are a marathon runner, they work out every single day prior to the pregnancy, they say that they do a 1 to 2 hour workout every day. I tell them to continue it. Anything that you've done prior to the pregnancy that your body is used to doing, you can do it. With some exceptions. Now, if you are a professional scuba diver, obviously, you can't do that while you're pregnant.
Right.
But other patients, they get very nervous about gaining weight, and they say, can I start working out? Can I start this new routine? I always recommend against that. So you don't want to start an exercise that your body is not used to during pregnancy, but to continue something that you're conditioned to do, that you've been doing for several months prior to the pregnancy, is perfectly fine.
And is it safe to say it's always smart, if you are a habitual exerciser, you got to listen to your body, because at some point you're carrying a lot of extra weight, you're carrying another human being, and you're going to kind of have to slow down.
Exactly, and that's what I tell patients. I say, just, kind of pay attention to the signs. If you're doing your normal routine and you're very, very out of breath and you're having cramping or you're having contractions, then stop and rest, or tone it back a bit. And the best thing that you can do during pregnancy is to just kind of be aware of what your body's telling you.
And it's going to be telling you a lot, right?
Right. Yeah. And women have a good intuition. So when I tell patients, if even during pregnancy, if you feel like something's not right, you feel like something is wrong, by all means, please, come call the office, come in and see me, because oftentimes, that intuition's correct.
Really. Let's talk about travel, especially with baby moons. They're so popular now. That wasn't a thing when I was pregnant. I wish it was. But a lot of folks still want to travel. They want to get in those last vacations.
Yes, baby moons. That can be a hot topic because women look forward to it, and they've been planning it. I recommend to patients, don't go out of the country on your baby moon. By all means, go to the beach.
Sure.
Have a good time, but I would recommend staying in the country. And as that goes, I do recommend, Zika is still a thing. It's not on the news.
Right, it's not. We haven't talked about it in a while.
But if you were planning a vacation early in the pregnancy, you're planning on going somewhere with your family, go to the CDC website. CDC has recommendations as far as which countries Zika is still a thing, and and recommendations on how long you should avoid pregnancy if you go to one of those countries, and what you should do if you've gone to one of those countries while you're pregnant. Beyond
vacationing, some women travel a lot for their jobs. When is it not safe to fly anymore? What should women pay attention to as they travel and are pregnant?
There's no cutoff, really. There are some airlines that will be hesitant to let you on because they're worried you're going to go into labor and they're going to have to land the plane early. But there's no real cutoff as far as OBGYNs are concerned. I tell my patients, if you're full term, if you're 38 weeks pregnant and you're going to go into labor at any point, don't get on the plane. Yeah. Okay. Because even if you're traveling within the United States, you might be delivering in a hospital where they know nothing about you. Your doctor doesn't know anything about you. They don't have your records. You're not with your family. So I definitely recommend traveling once you're full term. I tell my patients after 35 weeks, I wouldn't travel too far.
Let's talk about some common myths, and oh boy, there's probably a book full of myths when it comes to pregnancy. What are some that pop up with your patients in your office? You have to say, no, that's not really true, or yes, there is truth to that one. Sure.
So I think that probably the most common myth that I get asked about in my office is the prediction of the sex. So everybody wants to know very, very early, is it a boy or a girl? And a lot of people think that common myth, if you have a lot of heartburn, that it's a boy. And that's not true. You can have a lot of heartburn for various different reasons. I also hear if you have a lot of heartburn, then the baby has a lot of hair.
Yes, I've heard that one before.
There actually is a very small study that just came out that shows that there might be some truth to that.
Really?
But that study, it's a very small study and it's only one. So I think that's probably not true either, but
yet to be determined, perhaps.
We'll see if that plays out.
Some other ones that you've heard, what you're telling me about putting your arms above your head?
Yes, that's one that I've heard. That seems to be in certain populations of patients that their grandmothers have told them if they put their arms over their head, that the baby's cord could get tangled around the neck. Also, definitely not true. I mean, obviously we have patients who
do lots of things with their arms over their heads.
Like I said, you can do any of the exercises you were previously doing. So if patients were lifting weights before, then they can do that, and it has nothing to do with the cord around the baby's neck.
As we talk about common myths and reading and apps and everything else, I'm sure people come in and have all kinds of different books. They say, I've read this in this book, or this book told me this, because there is a plethora of books on the subject of having babies. What are some books or some apps that you like?
So there's a couple of books that I read in my own pregnancy that I really love, and you know, the standard one, this isn't a promotion for them, but What to Expect When You're Expecting. You know, there's some controversy about some of the things in there, but I tell patients, you know, it's a pretty standard reference, and a good reference for a lot of the common questions, and you know, what to eat during pregnancy, what to pack for the hospital, that sort of thing. And you know, there's a lot of websites. You know, I think What to Expect When You're Expecting has a website as well, and that's always a good reference.
Okay.
And your OB is probably your best reference.
That's a good point.
Yes.
That's a very good point. Let's talk about the gender. Things have changed even since I had my little boys, and my oldest is only 4, about to turn 5. But people can find out the gender pretty early.
Yes, there are blood tests that you can find out the gender as early as 10 to 11 weeks. That blood test is not specifically for finding out the sex, although a lot of patients
do that.
Request that.
What is it for?
So that blood test is actually to test for certain genetic defects.
Gotcha. What would it show?
So it shows, that's recommended for women that are advanced maternal age, which is an unfortunate title because that's just 35 years old and plus, and it shows for various different genetic defects such as Down syndrome.
Okay. So you could find out
different trisomies.
But it's also, you can find out the sex. Is it pretty accurate for the gender?
Yes, it's very accurate.
Okay. Interesting. And then the other way, the old-fashioned way, I guess, is the ultrasound, right?
Right.
And that's performed at what?
So your ultrasound generally is performed at around 20 weeks at your anatomy scan. So for patients, a lot of times they're like, 20 weeks, what is that? That's about 5 months. So at your anatomy scan, they'll do a full anatomy scan of the baby, meaning they'll look at the brain, they'll look at the heart, make sure everything is developing, and then they'll also look and see what the sex is.
What little tidbits are down there, and you get to find out.
Exactly.
Just kind of off the cuff, how many people actually want to know and how many people don't? Do you kind of have like a percentage?
Well, I don't know an exact percentage, although I will say there is a trend now that patients are wanting, a lot more patients I have found don't want to know the sex.
Really?
And usually that's with the second baby.
Yeah.
And so that is the trend now, and that's always fun in the delivery room too, to announce that to the parents, because they always, you know, they're always positive that it's a girl, and then it's a boy, and then it's very exciting.
Do you ask your patients who don't know, like, what do you think it is?
Oh, of course. And I tell them, you know, when I'm doing your ultrasound, if I refer to the baby as a boy or a girl, it's not because it's just, I'm just giving him a pronoun.
There you go. You're just giving him a pronoun and a personality. There you have it. Let's talk about the different controversies that come up, because there's a lot of push and pull when it comes to pregnancy. One would be C-section versus vaginal birth. Where do things stand right now with C-section rates and what you're telling patients about C-sections? So
I tell all of my patients, you know, I have a lot of patients that come in and they say, I'm really worried, you know, I chose you to be my doctor, and I really, really don't want a C-section. I tell all my patients, I don't want you to have a C-section either. I don't want anyone to have a C-section that is not medically necessary. So, you know, and I ask patients, you know, you have to trust me as your doctor that I will try to do everything for you and your baby to get you that vaginal delivery, because that's better for you and better for baby. And, you know, if it comes, you know, medical problems come up, an issue with the baby comes up during labor, you have to trust me that, you know, if I decide to do the C-section, that's what's best. Exactly.
When you do have to move to that decision of the C-section, what moves you there? What kind of things happen?
Sure, there are a lot of things that can happen in labor. Labor is, you know, there's no way to predict really. I mean, even as an experienced OBGYN, some of the most experienced OBGYNs that I worked with in New York, there's no way to predict. You know, we're all certain, you know, we're concerned about the baby's heart tracing. So during labor, we watch the baby's heart tracing continuously. And there are certain factors of that baby's heart tracing that if they become concerning, that can lead us to a C-section, okay? Because that can tell us that the baby is in distress. Okay, and there's only a certain point that we would want to watch that baby being in distress until we decide to do a C-section. Other issues could be that the mother's just not dilating. You know, we've done everything that we could, every intervention, you know, medication, time, etc., and the mother's not dilating. And that would be called, you know, an arrest of dilation. That would be an indication for a C-section. Occasionally, a mother will have had, you know, a certain surgery, a major surgery on the abdomen, or a medical problem that would necessitate a C-section before labor. Sure. And that would be addressed, you know, on an individual basis.
Yeah. Okay. On that note, we're going to take a quick break again. If you have a question that deals with baby making, baby having, now is your time to call. 615-737-PLUS is the number to call. We're coming right back. Stay with us.
This is a Storm 5 HD weather update. Sign up for Weather Call at newschannel5.com.
A soggy start to our work week, and you know, you want to keep the rain gear handy because it looks like our whole week will remain unsettled with some slightly better chances for rain, especially towards the middle and end of the week as Tropical Storm Harvey, the remnants of it, may begin to impact us here in Tennessee and Kentucky. Now, this is what the radar looks like right now. And of course, with clouds and rain in the area, that has helped to suppress temperatures somewhat. This is what it looks like across the southeast. Current conditions right here in Nashville. A reminder to you, this is updated on top of the hour. Overnight tonight will fall down to 66 with rain chances decreasing but not necessarily falling apart completely. And we'll keep the rain chances around for tomorrow as well. About a 30% chance to see an isolated shower and a rumble of thunder. Rain chance starts to become more widespread on Wednesday. This is as the remnants of Harvey start to slide towards the mid-state. We'll continue to have to track that very closely, but it could bring us some...
Everything starts out small. The things that hurt us, they all start from somewhere. The words we say, the things we do, they can grow into something else. What was small and innocent can become big and sometimes scary. All it takes is one comment, one picture, one video for something to catch fire. But a big problem doesn't need a big response. Not at first. Even if we don't know what to say, the eye emoji can be that first step we take. Let's all pledge to take that first small step together and change the world in a big way. I'm a witness, and so are you.
Welcome back to Medical Monday. I'm here with Dr. Melissa Walco with the Women's Medical Associates of Nashville, talking about babies today and having babies. If you have a question about getting pregnant or being pregnant or delivering, now is your chance to call. 615-737-PLUS is the number to call. Dr. Walco, I want to talk about birth planning. And when you read all these books or go through these apps and say, have a plan, and it's like, you know, what music you want to play and how you want to deliver and blah, 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 blah. How many people come in with a plan like, here's my birth plan?
You know, it's, you know, I trained in New York City, and a lot of patients came in with birth plans. Okay, so, I mean, I don't know an exact percentage, but I would say, you know, maybe 25% of patients came in with a birth plan that they had printed out, written out.
And usually what do they cover?
They can cover anything, okay? So they'll usually cover, you know, what the patient's plan is as far as pain control, you know, whether they want an epidural, whether they want to try nitrous, whether they, you know, want to go completely natural. It also covers, you know, that they want to avoid a C-section, which is pretty much universal. But, you know, as far as birth plans go, what I tell my patients, you know, a birth plan is a good thing to go over with, you and your husband, so you're kind of on, or you and your partner,
Right.
so you're on the same page. But as far as your doctor's concerned, just have a conversation with them, prior to going to the hospital. Tell them what your expectations are. Tell them, kind of what you have in mind, because having it written down on a piece of paper, we're there. You
Right.
can just
Tell me.
you can just tell me that you want the epidural, and putting you want to avoid a C-section or a complication on your birth plan. I tell patients having a birth plan is kind of like having a weather plan for vacation. Sometimes you don't want it to rain, and it just does.
Right. Exactly.
So have that conversation with your doctor and trust that they're going to do what your wishes are and what's best for you.
And I think you brought up a great point about talking to your partner about it, because oftentimes when you're in labor, you can't be like, well, here's what I want.
Right.
This is my plan and my wish. You're focused on what's happening with your body at that moment. And that partner can be your biggest advocate and the person who speaks for you, right?
Yeah, no, exactly. And I tell patients, it's kind of becoming it's a lot more common for men to be very involved in the pregnancy and very involved in the birth, and that's a wonderful thing. And I tell patients, have that conversation with your husband, but don't have it set in stone, because patients will say, I don't want anything for pain, I don't want I don't want an epidural, and when the time comes for labor, sometimes people change their mind, and that's okay too. So just tell your husband, this is kind of what I'm planning and what I'm hoping for, but if it doesn't happen, that's okay too, as long as in the end everybody's happy with that healthy, bouncing baby.
Right. Absolutely. Let's take it back a few steps before we get to the birth plan part. Let's talk about choosing a doctor, and a doctor that's right for you, because doctors come in all shapes, sizes, and prescribe to certain ideals. So what are some questions that you should be asking your doctor, whether you're trying to get pregnant or you are pregnant, when it comes to who's going to carry me through this season of my life?
Sure. So, patients come in, they always ask one thing, are you going to be the doctor that delivers me? Is it going to be somebody that I've never met? And in general, and certainly in my own practice, I can't be on call, unfortunately, for every single patient.
Sure.
And, I will see you through most of your visits in pregnancy, and, ideally, I will be the one that delivers your baby, but unfortunately, I have to take some days off too sometimes.
Sure. You have a family too.
And the same with my partners, but every doctor will be with partners that they trust and that conform to the same ideology that they do as far as patient care. So not only that comes down to trusting your doctor. Again, when you pick a doctor and you trust them, you have to trust that they chose partners that are also going to take care of them and have their best interest in mind.
Is it fair to ask, or do you take any offense to asking, like, what's your C-section rate, or do you do episiotomies, or do you try to not do that? Is it fair to ask those questions?
Of course. I encourage asking those questions, and every provider will be happy to kind of give you those statistics as far as what their C-section rate is, what their policy is as far as episiotomies, and patients will ask me, when would you do a C-section? Would you do a C-section because it's the end of your call and you're about to go home? That's obviously that's not the case.
And VBACs too. Tell me about what's called a VBAC, a vaginal birth after cesarean.
Sure. So a vaginal birth after cesarean, that varies from doctor to doctor. So that's 100%. If you've had a previous cesarean, you want to ask a new doctor, if you're going to a new doctor that didn't do your C-section before, do you do VBACs? Is that something that your practice does? If you're not the one delivering, do your partners do VBACs? Because that is, a higher risk delivery. So, and of course I would have that conversation with them as far as planning for that VBAC, what to expect, the risks involved.
And what are the risks involved with that?
Sure. Risks involved with vaginal birth after cesarean include the most concerning risk, and the one that I always counsel patients about, is uterine rupture. Okay, so you have a scar on your uterus. Your uterus is a very strong muscle, and when you have a C-section, that muscle is cut open, sewn back together. So that is a weak point in the muscle. And as that muscle is contracting during labor, if the scar separates, that's what we call a uterine rupture. And that can lead to an emergent C-section, and that can lead to an emergency for the baby, a deceleration in the heartbeat. It's also extremely painful and dangerous to the mother.
When you talk about C-sections and plan for a C-section with a patient, someone you know that's going to have a C-section, it's major surgery. I also think isn't it the most common surgery out there, I think, perhaps?
For OBGYN, yeah, certainly.
Without a doubt. How do you counsel them on preparing for it?
So I tell patients, this actually happened. My best friend actually had a planned C-section. She had a breech baby, and I talked to her a lot about this because she was terrified, like most patients are. And I tell them, have the conversation with the anesthesiologist beforehand. Okay, so the anesthesiologist in a C-section is your best friend because they're sitting at the head of the bed with you. They're the ones who put your epidural in, and they'll have the conversation with you as far as the medications that you're going to get. I also tell patients, I go through with them, when you're having the C-section, you're going to feel touching, you're going to feel pulling and pressure and pushing, and that is normal. Okay, you're not going to be completely paralyzed from the waist down. You will still feel us. You will not feel pain. You will hear things. You will smell things. Try to just prepare yourself for that. Usually they'll have a friend, a family member, a partner in there. I tell the partner, distract them.
Right. Keep talking to them about great things right now.
Exactly.
That's a good way. And then once they go home and you have this great little newborn, but you're recovering from major surgery, what are the expectations the mom should have?
Sure. So it's certainly okay to lift the baby. Obviously, we wouldn't want to do a surgery where you're not able to care for your infant, but really I tell them that's the only thing that you should be lifting. We'll give you pain medication because, again, it is a major surgery. Some patients will be so adamant that they don't want to take any pain medication. They're worried about the pain medication in their breast milk and giving it to the baby. We wouldn't give you any pain medication that would not be safe for breastfeeding. So take the pain medication because you're going to need it for a full recovery. And if you're not taking the pain medication, you can't move around, you can't do things for your baby. Moving around also helps you heal. Yeah. So, that's what I tell patients to be prepared for.
What about that healing process, whether you have a vaginal birth or a C-section? When should people expect to kind of be like, okay, I'm starting to feel like myself again?
So obviously it's different for the two. After a vaginal delivery, usually most patients are starting to feel that, again, can vary. There are different variations.
Sure, it's a continuum, yeah.
Exactly. So a patient, if they had an episiotomy or if they had a laceration, that can take longer to heal. So a patient will say, my friend had a baby and they felt fine, 2 days later. If you had a big laceration or an episiotomy or another complication, that could take you longer. So I tell patients, usually after a vaginal delivery, you're back on your feet and feeling normal again within about 2 weeks. Cesarean, give it about a month.
Yeah. Yeah.
And certainly if it's a repeat cesarean section, if this is your second or your third, it's a little bit harder each time, and that recovery takes a little bit longer.
Good information. How do you counsel patients, or does it even matter about having multiple children, whether it's like back to back? Does that cause different complications or different worries as you go forward?
Yeah, certainly. I mean, back to the VBAC question, if a patient is planning a VBAC and they have had their pregnancy very close together within a very short time frame, that puts them at an increased risk for those complications, the uterine rupture. So if a patient is planning a VBAC, I do advise them, if you're planning to have a vaginal delivery with your next baby, wait the 12 to 18 months before you get pregnant again, and plan for the VBAC in the future. And as far as a vaginal delivery, I tell patients, for many reasons, not just for your body, for your emotional, your mental well-being, I would tell patients, to wait that 12 months before they start trying to have a baby again. Now, obviously, a lot of women today are waiting later in life to get pregnant, and that's a special circumstance. If you're over the age of 35 and having your first baby, we can talk about having them closer together because, you know, time is limited.
Do you find with that second one that labor tends to really go faster, or is that a common myth?
That is definitely not a common myth.
Okay.
That's actually a very common thing. And I actually had a patient in my practice this week. 3 hours of labor and had her baby. So she's pregnant again with her second, and I told her, you get to the hospital as soon as you start contracting because that baby's going to come fast.
Yeah. Yes. Is it true? I mean, your body kind of has done it and knows what it's doing, and it just kind of becomes a little more efficient.
Exactly. Exactly. I mean, that's not universal,
sure.
but that's definitely more common for the baby, the second baby, third baby, and on to come very fast.
Yeah. Okay, very good. We're going to take another quick break. More on having babies when we come back. Stay with us.
Joyce, how you feel today?
Oh, my back is killing me.
You take care of getting well. We'll take care of the law part.
Thank you. Thank you for coming.
The experiences, the kind that take your breath away and remind you what it feels like to be alive. Catching a glimpse of life under the sea or on top of the world. Walking in the footsteps of soldiers, legends, and kings. It's a feeling, a connection that can only be made in Tennessee. Start planning at tnvacation.com.
There's no single answer to securing your financial future. You need to look at it from every side. Get dependable advice you can count on every week with the Retirement Report on News Channel 5 Plus. Experts on finance, taxes, and the legal system are ready to answer your questions. Don't wait to make a plan for your money. The Retirement Report, Friday mornings at 8 and at these encore times on News Channel 5 Plus.
New this fall.
My name is Alex Riley, and this is the story of my life.
Experience one man's past.
Did everything just go slow-mo for a second there? Yeah, you'll get over it.
Present.
Whenever I hear this song, it makes me think of a girl.
Mommy?
No. Mommy's song is Psycho Killer.
And future.
I may be entering life's fourth quarter.
Oh, seriously, did you come out of the womb speaking in basketball metaphors?
Me, Myself, and I. New comedy CBS this fall.
Hell and High Water. Next inside edition. A hurricane for the ages. America's fourth largest city in crisis and bracing for more rain. Then, a gender reveal party unlike any you've ever seen. She's having sextuplets.
We never imagined 6.
From 3 kids to 9. Watch the next Inside Edition.
Today at 4:30 on News Channel 5.
Johnny Lynn watches the news differently than you do. Tony is thinking about his son. Molly is listening for change. Crime in our community is not just a string of facts. Everyone has a story that changed their life. News Channel 5 tells that story, keeping you safe, informed, connected.
With CBS All Access, you can watch News Channel 5 live from anywhere and watch CBS shows on demand across desktop, mobile, and streaming devices. Go to cbs.com/all access now to try it free.
Online. Welcome back to Medical Mondays. I'm here with Dr. Melissa Walco from Women's Medical Associates of Nashville. So if you have a question, go ahead and give us a call. We'll also show you how you can make an appointment with Dr. Walco here in just a little bit. So you might want to grab a pen and paper, and we'll get you set up for that. We have a number or an email address that you can send a message to. So we're going to get you hooked up. In the meantime, I'm going to continue to ask the questions unless somebody calls in. 615-737-PLUS is the number to call. Let's go over the care schedule that someone can anticipate for that 9 months, really 10 months of pregnancy.
Sure. So usually when I see patients, they're around that 8 to 9 week mark. Okay, so that's the first trimester. And, you know, in that stage, we usually see them every 4 weeks. Okay, obviously if they have a complication or something that we need to see them sooner. And then after that, you know, initial 4 weeks, we'll do every 4 weeks up until the second trimester. Then we start doing every 3 weeks. As you get further into the third trimester, every 2 weeks. Okay, and then at 36 weeks, it's every week after that, okay, until the end. And usually I tell patients every time I see them after that, could be seeing you on labor and delivery, but if I don't, I'll see you next week in the office.
And what do you do in that final stretch when you're in, on the weekly appointments? What are you checking?
So every week, we'll do a vaginal exam, check the cervical dilation. I'll go over with patients, are you having any contractions, any leakage of fluid? I'll give them all the precautions that we give for our term patients. So making sure that they're doing their fetal kit counts, making sure that they're paying attention to the baby's movements, giving them precautions as far as bleeding, leakage of fluid, what to prepare when they go to the hospital. You want to make sure that you let your OB know when you're going to the hospital. That's important. And, just any general questions, because patients, I find as they get further toward the due date, they start to have more and more questions rather than less questions.
I'm sure. Absolutely. What about, and this is a question that maybe some people won't ask you because they're embarrassed, sex with pregnancy. It's okay, right?
Yes, I get that question actually a lot, usually from the partners.
And that doesn't surprise me.
And I tell patients, unless your OB has specifically told you, there are a couple of conditions where sex is unfortunately a taboo for the entire pregnancy, but obviously your OB would go over that with you. So unless you have one of those conditions, sex is totally fine. Now, if you want to tell your partner something else, that's up to you.
We talked a little bit about diet at the beginning of the show, and I do want to talk about it again because, we also talked about common myths, and people are like, oh, she's eating for two. That's not really the case, right?
I talk about that with patients from the very first visit, and it's a sensitive subject with women. And I tell patients, this isn't to criticize, hurt your feelings. This is telling you because it's best for you and your baby. So if you are at a normal BMI when you become pregnant, so that's a BMI that's less than 25, and that's easily calculated. I'm sure there's many Google calculators for calculating your BMI. Obviously, your doctor would also calculate that for you. If you're at a normal BMI, 25 to 35 pounds, totally fine. Okay? If you are overweight, there's different levels, varying levels of being overweight. So overweight, obese, your doctor will talk to you about that. But if you're overweight, usually no more than 25 pounds is recommended.
And keep in mind, I guess, when you're having your meals or whatever, you're not eating for an entire human being, but you do need good food for that growing baby.
Certainly, a lot of women, they kind of see it as their opportunity to kind of eat whatever they want, just give in to those cravings, and those cravings are real.
Yes, they are.
I've been pregnant myself, I understand. But, I tell women 300 extra calories a day is really what you need to
for the span of the pregnancy.
For the span of the pregnancy, to give your baby, the nutrients that it needs. And babies get nutrients no matter what you get. Those babies, they get what they need in general. But 300 extra calories, so that's really
not a lot.
That's not a lot. That's maybe a half a sandwich and a piece of fruit a day.
Yeah, but it is okay every now and then to splurge. I mean, why not, right? As long as it's every now and then.
Of course, and that's what I tell patients. I say that's kind of the fun of being pregnant. Eating the ice cream, that you normally wouldn't eat, eating the donut, eating those, cravings that you have. That's part of the fun of it. You just have to do it in moderation. Gaining too much weight, again, this is another thing I tell patients. This isn't to be critical. It's not a vanity thing. It's for the health of you and your baby. So gaining too much weight during pregnancy puts you at an increased risk for a variety of complications. It puts you at an increased risk for gestational diabetes. It puts you at an increased risk for hypertensive disorders of pregnancy. So disorders where you have problems with your blood pressure. And that can lead to a variety of problems with the baby itself as well. So, not to be critical, but
but to be informed
in your best interest.
Yeah, absolutely, it is very important. My producer was cutting it. I thought she was going to tell me, and she did. Samantha's on the line. Samantha, thank you for calling in tonight. What's your question?
Hey, I just have a comment.
Okay.
About nutrition in pregnancy. I just wanted to say,
before I got pregnant, I never would have ever touched kale. And after I got pregnant, I craved it, so I went with it and got some and ate it, and now I can't get enough of it. And my baby is almost a year old, and she loves kale too.
Isn't that funny?
And encourage all those crazy cravings. Sometimes they might be good for you.
Oh, absolutely. You're absolutely. In my first pregnancy, Samantha, thank you for calling in. I craved grapes like nobody's business. I ate so many grapes. And my son loves grapes. It's crazy. I don't know if there's a correlation.
Oh, there definitely is a correlation.
Is there?
So that's another thing that I tell patients, give into those cravings, but remember, this is your one opportunity to grow this baby. This is your one opportunity that this baby is developing. So pay attention to those nutrients. Try to eat a balanced diet, because in addition, the same thing, the baby likes kale. Well, those babies, there is some research that shows that if you eat certain foods during pregnancy, that the babies will have an inclination toward them later in life. And certainly, kale is a wonderful craving to have. So.
No joke. But my second one, I wanted sweet, so I got off the grape kick.
Yeah, I liked donuts. So.
Pregnancy should be full of joy and bliss. Sometimes getting pregnant or staying pregnant is really just a heartbreaking situation. Let's talk about miscarriages a little bit. What do you see? What causes them? What do you tell patients when it comes to trying to get pregnant again?
Sure. So, miscarriages are very, very common. So, and that's one of the first things that I tell patients, because they're devastated and they want to know, why did this happen? What was wrong? How could I have stopped it? In general, I tell patients miscarriages are very common. About 20% of pregnancies end in miscarriage, and that is due to a genetic defect in the baby. So the baby had a trisomy, an extra chromosome, where the baby would not have survived. Okay, if you had carried the baby to term, baby wouldn't have lived much longer, or the baby might have died later in the pregnancy, in your second or third trimester. So usually a miscarriage is for that reason. Now, if I have a patient that has had multiple miscarriages in a row, then that indicates a further workup. So I would usually recommend those patients to a maternal fetal medicine specialist who specializes in somebody with high-risk pregnancies or with recurrent pregnancy loss.
And what are they looking for or looking at that point?
So usually they'll look for if the mother and the father of the baby are carrying some of those genes. So if they're both carrying some of those genes, that can put them at a predisposition for having a baby that that causes those recurrent miscarriages. The mother can have a variety of different genes that she carries that really have no effect on her whatsoever, but certainly could affect pregnancy.
And once somebody has had a miscarriage, how long should they wait before trying again?
I usually tell the patients, it depends, because again, we have patients who are older population, and older, I mean older. But reproductively speaking, for a woman, we call that advanced maternal age. So, but I usually tell patients to wait a few cycles. So wait, at least 2 or 3 periods before they try to conceive again.
And is it just to kind of get your body back in its normal working order?
Your body, your mind, your mental well-being, everything. Exactly.
Makes sense. And then fertility-wise, you were saying earlier, try for at least 6 months, more like 12, before you kind of really set off the alarm bells.
Right. Again, like I said, most patients, they're in our office long before that 12 months. Okay, so usually around 6 months is when we're seeing those patients, because they get antsy and they get nervous, and that's perfectly fine too. I mean, I'm happy to see my patients, even if they've been trying for a few months, I'm happy to see them and go over, kind of what they're doing, when they're having their intercourse, when they're timing it, etc., and go over any questions.
Fantastic. Speaking of questions, if you have a question, would like to make an appointment with Dr. Walco, get your pen and paper ready. We are going to give that to you right when we come back. So do that in the break, and we'll see you right after this.
This is a Storm 5 HD weather update. Sign up for Weather Call at newschannel5.com.
A soggy start to our work week, and you want to keep the rain gear handy because it looks like our whole week will remain unsettled with some slightly better chances for rain, especially towards the middle and end of the week as Tropical Storm Harvey, the remnants of it, may begin to impact us here in Tennessee and Kentucky. Now, this is what the radar looks like right now, and of course with clouds and rain in the area, that has helped to suppress temperatures somewhat. This is what it looks like across the southeast. Current conditions right here in Nashville. A reminder to you, this is updated on top of the hour. Overnight tonight will fall down to 66 with rain chances decreasing but not necessarily falling apart completely. And we'll keep the rain chances around for tomorrow as well. About a 30% chance to see an isolated shower and a rumble of thunder. Rain chance starts to become more widespread on Wednesday. This is as the remnants of Harvey start to slide towards the mid-state. We'll continue to have to track that very closely, but it could bring us some...
One of my most rewarding experiences as a dietitian has been actually quite recently, just a year ago, when I met Donna, because she was so motivated and ready to lose weight and to get healthier.
Well, since I've met Sue and listened to her guidance, I've lost about 80 pounds, and I have been taking off almost all my medications. To me, I mean, that's something to shout about.
I think for Donna, the biggest change has been what's happened up here. Her perspective on food, nutrition, fitness has just changed dramatically. She looks at food differently, she thinks about food differently, and the fact that nutrition and exercise, they're just a routine part of her life.
I just see the future getting better and better and better because I'm getting healthier and healthier and healthier. It's just been a whole life change, and I don't want to ever go back to the old ways.
Welcome back to Medical Monday. We're talking about having babies today with Dr. Melissa Walco, and someone has that positive pregnancy test here in the next couple of days, or they just had one. What's the next step?
So I tell patients usually to call, if they don't have an OB, start making those phone calls, especially here in Nashville. There are a lot of OBs that are booked out for months. So I'm accepting new patients. I would tell them to call right away as soon as they have that positive pregnancy test, and usually by the time they're able to get into that appointment, it's usually around that 7, 8, 9 week mark, where we can do an ultrasound, confirm the pregnancy, even see that little heartbeat.
Oh, that's always a precious time. That's exciting.
Exactly.
Very good. I want to give you the number and the email address where you can make that appointment, and here it is. Go ahead and give them a call. The number's on the screen, 615-986-6033. You can send an email if you would like to make an appointment request to Medical Mondays at ouradvancedhealth.com. Let me say that number for you one more time, 615-986-6033. Dr. Walco, thank you for being with us. It's been a fun conversation.
Thanks so much for having me.
You're welcome. All right, everybody, have a great night.